Alright, so we begin this video by showing the different types of equipment we have before we do any assessment or any interaction with the patient. We got our equipment, so we have our blood pressure machine, temperature, the RBS machine. We also have things to shave the patient, as well as the trays to administer medication, as well as to put away certain items from the patient. I wasn't able to get a real patient to do this procedure, but I have a full-size boxing bag, and his name is Venom, as you can see. So he will be my patient today. He also has on some jewelry as well, so we need to take off. So when it comes to the medication, we always need to check as a nurse. First, the medication, the pre-anesthetic is given 45 minutes to 75 minutes before anesthesia is begun. Hence, the nurse should administer the medication accurately at the prescribed time, otherwise the medication will be worn off or will not have begun to act when the anesthesia is started. Alright, and then we encourage the patient to remain in bed until with the side rails up, because the medication will cause lightheadedness and drowsiness. And then we directly observe the patient for any reactions to the medication. Surrounding areas should be kept quiet for patient relaxation. Alright, so these are just the basic understanding of what should be done prior to your interaction with the client. So now we will begin and how we meet the client and what we go on from there. So initially, before and during we meet the client, we need to do an assessment of the client as well as the surgery that is needed to be done, so that we can adequately prepare for the surgery date itself. So with the assessment, we need to determine the type of surgery, the preparation regime for type of surgery, which is the agency's policies, the hospital policies. We need to make sure that there's a signed consent form on a chart before administering pre-operative sedatives. And then we need to understand the client's perceptions of previous surgical experience. We need to have ready the admission history and the physical examination for factors increasing risk for surgery. Example, the patient's age, any chronic or acute illness, fluid and electrolyte imbalance, learning or comprehension ability, and if there's any language barriers present. So some potential diagnosis for the patient: we have anxiety related to impending surgery. So now we move on to the actual procedure itself. Alright, so we go to our sink station and we wash our hands, and then we perform hand hygiene. And as you can see, we already organized our equipment on the table before. So firstly, we introduce ourselves to the patient. Hi, good day, Mr. Venom, how are you doing today? And we try to build a relationship with the client. And with that, we try to assess the level of knowledge that the client will have on the impending surgery and the need for the surgery. So with that, if you realize that the patient does not have much understanding of the surgery, you could reinforce these by showing films on the television, or you could show booklets to provide information regarding the surgery as well as the post-operative care. Alright, so next we would want to figure out from the notes. So you check the notes to see if the signed consent form has been signed. You would like to make sure that the patient has all laboratory works done, such as x-rays, any ECGs, you make sure that they're done. You make sure that the pre-operative medications are available. So if you have to call or make arrangements with the doctor and pharmacy to make sure that the pre-operative medications are there. So then we do an assessment of the client. So we obtain the client's height and weight, and then we perform a head-to-toe assessment of the client. And particularly, he's having an abdominal surgery, so we would want to focus more on the abdominal area to assess his site, as well as to determine, if there's any complications prior to the surgery that could hinder him from going into surgery, because we need to be able to advocate for our patient. Alright, and then we try to introduce the client into what to expect when they enter into surgery, as well as the equipment they might see before and during the surgery, before the surgery is actually going to happen. So you can demonstrate to the client what the oxygen mask looks like, as well as the endotracheal tube, and also you can explain to the patient the particular noises that will be heard during surgery. With that, you will try to have the family present. So Mr. Venom and his family will be present, and you will discuss with them the process of the surgery, as well as what to expect post-operatively. So you can also inform the patient on the important aspects, such as the visiting hours, the agency's policy, as well as you can introduce the family. So Mr. Venom's family can see the area that they're in, the hospital, the surrounding. So the night before the surgery, you would put on gloves. I have my gloves somewhere. Right. Put on gloves. And when you put on gloves, you shave the designated body area, so the abdominal area, and you shave the particular part of interest. And then you instruct the client that we will be withholding foods and fluids after midnight before surgery. You need to check if there's any IV fluid and the amount that is going to be given. Then we check the chart to determine if any medications that will be given at the particular point in time in the night prior to the surgery, depending on what time it is, as well as the effects that the particular medication is going to have. Then you remove your gloves, and then you perform hand hygiene. From there, on the morning of the surgery, you need to verify with the patient, which is Mr. Venom. You need to verify the ID bracelet. You need to see, okay, Mr. Venom, what's your name? You ask the patient name, and you verify with their bracelet. You need to remove all jewelry. So all the jewelry, you ask permission, and you remove it. If you can give the family members it, if they are present. If not, you put it in the sealed envelope, and you give it to the ward. You remove any dentures the patient might have, any full or partial dentures, and place it in a safe container when they're covered. 30 to 60 minutes before surgery, the surgery center signals to the client the pre-operative medication must be given, and you must also recheck the ID band. And for the drug administration, you need to perform the 3 checks, right? As well as the 3 checks and the rights for the drug for the patient. So with the 3 checks, alright, so the 3 checks are the name of the person. You need to check the strength and the dosage, as well as the frequency against medical order, the medication container, as well as the MAR. Right? And you also perform the 6 checks, the 6 rights, sorry. The 6 rights are the right drug, the right dose, the right patient, the right time, the right route, and the right documentation. So you would then move on. Before you would move on to obtain the vital signs. Alright. So the temperature, the pulse, and the respiration. As blood pressure is not considered a vital sign, it is still done. So you ask the patient and you go from there, you obtain. Once it's stable, you administer the ordered medication. Right? When you administer the ordered medication, you make sure that you leave the patient with the side rails up, as some of the medication will cause lightheadedness and drowsiness. So, when the operating room personnel comes to get the patient, carry down the patient to theater, right, you need to compare Mr. Venom's eye bracelet with that of the notes and make sure it's a correct slip. It's correct with the slip that the theater has sent up. So you check the correct spelling of the name and you check the correct number, because they tend to mix it up sometimes. Then you assist the client, either it's on the wheelchair or the stretcher, depending on what. If it's an abdominal surgery, most likely it's going to be on the stretcher itself, right? Or it could be on a wheelchair. Then you write the final note in the chart. Basically, this is where you document how you gave over, and you're always communicating with the patient. You're always trying to make sure that they're not anxious, and you try to alleviate their fears by answering questions and making sure that they're comfortable. Any questions that the family have, you try and do it. And since my patient is not, this is a dummy patient, and I'm actually doing the assessment, that's why I'm kind of reading out, because I can't really get a response. So all those things that were done before, you have to document. So the documentation for this patient, so after you ask him that, Mr. Benham, that you got the consent form signed for the surgery to be done. So first is the presence of a signed consent. And then we make sure that we teach the patient. So we have the pre-operative teaching, which was before the equipment is being used, as well as what to expect pre-operatively and what to expect post-operatively for him as well as the family. We need to make sure that the preparation procedures were performed. We check to make sure the vital signs and the clinical data are of a stable value for surgery. And then we make sure that his valuables, which was his watch and his chain, were put away safe so the family could get it. And then we completed our preoperative checklist, which we have here. So we check all the information for him before he goes into surgery, like his particular condition or any potential for future complications, even during the surgery itself. We check to make sure that the lab results were okay, and that there were no abnormal results prior to the surgery, which would have been reported to the doctor. And then further teaching on the preparation would be done after the surgery. And then we make sure that we always check the pre-operative checklist to make sure that we've signed off on certain things, the certain criteria for the surgery.